Babies don't feel pain, right? From the moment they enter the world, babies capture our hearts with their innocence, vulnerability, and love. Yet for much of history, the notion of babies experiencing pain and emotions was met with skepticism. These beliefs undoubtedly led to unnecessary pain for infants. But the question is, how did this happen? Before anything, let's define pain. Sure, there are many ways, but the International Association for the Study of Pain, IASP, defines pain as an unpleasant sensory and emotional experience associated with actual or potential tissue damage, or described in terms of such damage, and is expanded upon by the addition of 6 keynotes. Now, for a long time, humans have known that infants are sensitive to pain, with 16th century surgeon Felix Wurtz of Basel writing, "If a new skin in old people be tender, what is it you think in a newborn babe?" So pain in infants was recognized and documented in ancient times, and even into the 17th century. So what happened? Starting in the late 19th century, doctors were taught that babies did not experience pain and were treating young patients accordingly. From needle sticks to tonsil removals, even as far as heart operations, nearly all procedures were done with no anesthesia or pain management. The belief was that in babies, the expression of pain was reflexive, and owing to the immaturity of the infant brain, the pain could not really matter. But what was the deciding factor in these new beliefs? As far as we can tell, most things point to this man, Dr. Paul Flechsig. His research into the new science of embryology led him to believe that non-myelinization of much of a baby's nervous system equated to an inability for said nervous system to function, and therefore feel pain. It was generally believed that babies would not remember any pain that they happened to feel, and that lack of conscious memory meant lack of long-term harm. Worries about use of anesthesia in babies added more fuel to the fire, with general medicine accepting that it wasn't worth the risk to use in the case of infants. Other scientific studies on animals with various brain lesions were interpreted as supporting the idea that the responses seen in babies were merely spinal reflexes, and the whole effort of relieving pain was considered wasted time, as it was thought to be impossible to measure an infant's pain and prescribe the correct non-lethal dosages. All these factors, grouped with concerns that the uses of opiates would lead to addiction, contributed highly to the medical professionals' continued practice of not providing pain relief for babies. It's important to mention that different countries have had different approaches to infant pain relief, but in this video, we have mainly been focusing on statistics and details from the US and Europe. With that said, the major shift in the United States was brought about by events surrounding one operation in which infant Jeffrey Lawson underwent open heart surgery in 1985. His mother Jill later discovered he had been operated on without the use of any anesthesia. The mother's fury sparked her to start an awareness campaign, which would go on to garner so much attention that the public and medical world had to react. By 1987, medical opinion had come full circle, with numbers of articles about neonatal pain increasing fourfold from 1985 onwards. The majority of these articles came from the countries we have focused on, lending to the idea that other parts of the world have long had a better understanding of pain in infants, and therefore didn't need to research what they already knew. So it seems as though by the mid-80s, the medical profession was taking pain in infants seriously. Though from our own research, we can see that some of these misguided beliefs amongst doctors not only lasted until the 80s and 90s, but even manifest themselves to this day. But that's not where this story ends. Because although now, in 2023, it is accepted that infants respond more extensively to pain than adults, it's also known that exposure to severe pain without adequate treatment can have extreme consequences. You only have to think of how many babies were born in the US alone between 1890 and 1990 to grasp the scale of the widespread trauma that could have been caused by all of this. How many of them babies suffered through traumatic experiences at the hands of misguided doctors, only to later live an adult life full of trauma-related issues? Well, the research on this side of things is blurry. I mean, it's quite difficult to find well-documented studies about the long-term effects of these medical beliefs, and I'm also limited to the time I put into these videos, so if anyone can help me out in the comments, that'd be great. But still, one question remains. We know humans are capable of extremely inhumane and cruel acts to get what they want. And could we be looking at generations of trauma victims that were put through extensive pain for the benefit of medical science? I'm guessing we will probably never know. Thank you for watching my first video. Please like, share, and subscribe.